Back to What Matters This Week. I'm Lauren Maloney. Joining me this Sunday is Dr. Hugh Garavan from the UVM Lerner College of Medicine. Appreciate you being here, sir.
Oh, I'm delighted to be here. Thank you.
We're going to talk about the ABCD study that's getting underway just as we speak, otherwise known as adolescent brain and cognitive development. 21 sites. UVM is one of them. That's a big get.
Mm-hmm. Yeah, it's 21 sites across the nation. It's a big project coming out of the National Institute of Health. What they want us to do is recruit 12,000 kids. That's what they want us to do, recruit 12,000 kids and follow them for 10 years. So with very extensive assessments, and the idea being to try to understand adolescent development and all the things that might influence it.
9 to 10-year-olds.
All of them 9 to 10 at baseline, yeah. And here in Vermont, so recruitment just came to an end. We finished recruiting our sample in the middle of October, and we recruited 577 kids from Vermont to contribute to this larger goal of 12,000.
How was it to get these kids and their parents to agree, to say yes?
It was actually, we were more successful than we expected. We were quite fearful at the front end because 577 9 and 10-year-olds in Vermont is pretty close to all of them. So we knew we had a tough recruitment challenge, but we got great buy-in from the school system because we did all the recruitment through the schools. We got great support from superintendents, from principals, from teachers, and in fact, our recruitment numbers in terms of the percentage that we were able to recruit is higher in Vermont than in any of the other sites across the US.
Wow.
We have some schools where about 20% of all the eligible kids actually signed up to participate, which is a really fantastic amount of support. And so yeah, so the parents especially have been super supportive of the study.
Now, you told me it was important to kind of get interactions between the kids, so there are sub-siblings, twins even?
Yeah, so we, the only real rule was just 9 and 10-year-olds, so if there are siblings, that's fine. We also, by design, included a large twin cohort. So the advantage of having twins in a study, so half of them, we have about 2,000 twins, half of them are identical, half of them fraternal, is that then it's a perfect test for being able to kind of control genetic similarity, but maybe then look at developmental differences that might arise from, let's say, if one twin engages in some behaviors that the other doesn't, and then any differences that emerge, we know, well, it's not due to the genetics if they're identical. We also have, I think we have one family that is participating with 5 kids. They have one set of twins and one set of triplets in the one study. Not here in Vermont, but elsewhere.
What are you looking for when it comes to this? We talked about screen time, social media use, but behavior, right?
Yeah, so the basic idea is we don't have a proper comprehensive understanding of what adolescent development looks like, especially brain development. So if you kind of think of it as analogous, young kids go to a doctor's office, there are height charts, growth charts. We don't have anything like that for brain. And we know that there are substantial changes. If anybody thinks back to their own adolescence or thinks about their own kids, the changes that go on from 9 to 10 up to ages 19 and 20 are just substantial.
It's a big chunk of a lifetime.
Yeah, it's a critical period. The brain is very plastic. There's a lot of changes. So physically, kids are going through puberty. There's a lot of changes happen in the brain. Personality issues kind of get established, friends, social behaviors. It's also a period of time, and perhaps this is related to the plasticity of the brain, where a lot of mental health issues emerge.
Yeah.
So the idea of trying to understand, to do this study is, again, like I say, comprehensive understanding, and then to properly understand all the things that can influence development. So you just mentioned there, things like sleep, or screen time, or nutrition, or exercise. Like, we know these things are important, but we don't really have a very good understanding of how they interact with one another. So, for example, a lot of parents are concerned about screen time, kids spending too much time gaming or playing video games. And does that have a detrimental effect on development? Or is it the fact that because they're engaging in these games, they're not getting enough physical exercise? So if you have lots of physical exercise as well as gaming, then maybe the gaming isn't as problematic. So these are the sorts of more nuanced questions that we want to try to get at, and maybe hopefully come up with some good recommendations for what's a reasonable amount of each type of behavior that kids might engage in without having substantial changes on brain development.
How often do you want to meet with the group?
So we meet with the group. We have interactions with them at the moment every 6 months. So
Okay.
they come into UVM once a year. And so that's a pretty extensive assessment. I mean, again, our kids and our parents are fantastic. It's about 8 hours of assessment, so lots of psychological assessments, cognitive tasks. We take samples for genetics. We do functional brain imaging. We then have a follow-up phone call after 6 months. After 12 months, they come back into the lab, but there's no MRI scanning. Another follow-up at 18 months, and then at year 2, they come back and repeat the whole baseline. And then that repeats until they're age 20.
Okay. Will you get some response or some readout in real time? And do you pass that along to the parent?
Right, we don't.
Okay.
Yeah, so it's really important that for us to get honest and valid data from the kids, that they feel that they can tell us everything. So some of our questions we'll ask them about their emotional feelings, about any sort of sadness or depression or anxiety. Mm-hmm. In time, we'll ask them questions about substance use, which obviously is something that emerges during adolescence. And the only way that you get really truthful, valid data is if the kids feel like these data are completely confidential. Now, we will break confidentiality in certain circumstances. I mean, and the kids know this. So if they report anything to us that puts them at any kind of immediate risk,
sure,
then we will talk to the parents. Or if in the MRI scan we observe any kind of an abnormality, then of course we give them feedback. But the parents know this and sign up to it, and the kids know this and sign up to it. And similarly, we don't tell the kids what the parents say about them, and we don't tell the parents.
Yeah.
Exactly. Yeah.
Okay. Before enrollment, was family history taken into consideration when it came to any of the children?
No, what we wanted to do, as I say, is to try to get a good comprehensive understanding of adolescent development, is not have to have as few exclusion criteria. We really want to have a good cross-section. And actually we went to a lot of trouble to ensure that we have a sample that has a good representation in terms of sex, race and ethnicity, and socioeconomic status. Mm-hmm. And so those were really the only criteria when we went out. But essentially we went to schools, described the study, and then anyone who was interested was enrolled. And that sort of operated across the 21 sites.
When they get to be 19 at 20 years old, you said there's even a path to keep this going through their 20s.
Well, we would hope so. Everything is grant willing. But
sure.
Our expectation is that if we have done a good job and we follow this cohort and we have very rich data, then it would just be such a shame to let the cohort go. So once they hit 20, then all sorts of other interesting developments happen. They go off to college, many of them, or they're working, they start their employment. Many of them must maybe start developing important relationships, or even health issues may start to emerge. So of course, the hope long term is that we will follow this cohort, maybe even indefinitely. But for right now, the primary goal is
one step at a time.
Yeah, one step at a time, is to get them through to age 20.
Okay, excellent. Well, I appreciate you being here. Thank you so much.
No, delighted. Thank you.
And we'll be right back on What Matters This Week.